Welcome to the second episode of VICHARDHAN with Dr. Sunirmal Sarkar. In our last episode, we were talking about how homeopathy is being effective for the children with neurodivergent disabilities. Let's continue our conversation with Dr. Sarkar. So also now, when we talk about other therapies, especially allopathy, and it for some parents, some patients we have seen it works in calming them down. Also, there are some time-specific things like seizures or spasticity, and people prefer to go for allopathy for that. So, do you think homeopathy will work there? One, and how the integration of both the therapies, allopathy and homeopathy, also some other conventional therapies like OT and PT, how does the integration work?
Integration definitely. Just one thing I am telling, every system of medicine has its own beauty, own efficacy, and I am not a failure, but it has its limitation. Every medicine, it has its strength and limitation. But whenever we are telling that this seizure, convulsion, definitely we are giving some particular medicine. I am not mentioning the name of the medicine for 5 years, 6 years, whatever it is. Definitely, it can, in most of the time, it is making them feel free or the symptom free.
Yeah.
Okay, but most of the time, what you will observe, you have to take medicine for 5 years, 6 years, 10 years, 12 years, like that way. But still, that EEG, in most of the time, it is not normal.
It is not, yes.
Sometimes it may be normal, but most of the time, or even I am telling that most of the time it becomes normal after 5 years or 10 years, but some percent of the patient, they are not showing the normal EEG. Because whenever it is simply we are giving a convulsion or epilepsy, they are also why and how it started. This is in neurological problem, I think homeopathy leads or supersedes other medicine why I am telling that convulsion, simply we are telling convulsion, it may be clonic, it may be spastic, it may be whatever it is, but when you are observing the patient is during convulsion bending forward, bending backward, bending sideways, passes stool, passes urine, not all, forgets everything after what happened to me. So, if you subcategorize this, even the convulsion, how many way we can differentiate the children, you cannot imagine.
True.
New moon aggravation, full moon aggravation.
Right.
Modern medicine may not believe it, but it happens. Yesterday also we have seen, the mother is telling that only new moon and full moon मेरा बच्चा का बहुत irritability ज़्यादा हो जाता है. We may not explain with any way that how it happens, but the relation or the reaction from the waves of the sun, waves of the moon, even seashore, sea aggravation, it is there. We cannot deny it, but we can't explain it.
Correct.
How it acts. So, this is the beauty, new moon aggravation, full moon aggravation, convulsion looking backward, convulsion, eyes going turn upward, going downward. So this is the way homeopathy they are differentiating. And another thing I am telling, what homeopathy can do in a special group of convulsion, that is history of trauma. After head injury, neurological development is not proper, or the blood clot, it is gradually making the gliosis, gliosis of the brain. So that leads to convulsion, and with mental traumatism, that is forgetfulness, change of the personality of the child. Previously, he was performing very good results in academy. Now, after that head injury, convulsion is there, but simultaneously, the child is gradually becoming academically, performance is not satisfactory. This both can be covered with if we treat homeopathically, the adverse effect of the injury, mechanical injury, fall injury, physical injury, mental injury, and that is only possible through the dynamic homeopathic potentized medicine. So if we correlate with modern medicine with this homeopathic part, I think cure rate or the problem rate we can minimize like anything. So it is not complementary, it is not substitute, but we have to go hand by hand.
Okay.
And more the acceptance from the modern medicine, I think our economic burden through homeopathic medical expenditure can be minimized, and the better result definitely we are expecting, and it should do. That is not complementary medicine.
Okay. So if some child is already on allopathy medicine and we start homeopathy medicine side by side, do they integrate well, or you would advise to replace allopathy medicine completely with the homeopathy
Initially
medicine?
it should not be, because there is some withdrawal effect. Suddenly if you withdraw this type of medicine, so the withdrawal effect may come. Initially, with a time gap, half an hour or 1 hour, whatever it is, if you give homeopathy and allopathy at it slowly for 5 months, 6 months, that according to demand of the disease or the person, and more biochemical analysis, and even the instrumental intervention with scan reports, if it is slowly improving, because previously when only allopathy medicine was given or other system medicine was given, it was not improving.
Yes.
Now when conjointly we are giving allopathy and homeopathy, and it is showing even pathological improvement, that time we can minimize slowly allopathic medicine.
Okay.
Otherwise it should not be withdrawal on a sudden.
Yes, totally agree with
Totally.
that. Yeah. Now also we have a conception, or maybe I am looking for clarity from your side, that homeopathy treatment usually takes a long time to cure or to see the changes, and generally patients do not have that much of patience. People don't want to wait that long to see the results. So in such cases, how do you encourage the children or parents to continue with the therapy?
Actually, the question is cure and temporary relief of the symptoms. Honestly, it was a misinterpretation of homeopathic, misinformation rather I am telling, that homeopathy is a slow acting medicine. It absolutely not. Absolutely not.
Okay, because that's what we all have been hearing, that Ayurvedic homeopathy
Just
medicines
here
take
also,
time.
if we go through the history, that penicillin or the antibiotic or the modern medicine, the glorious activities of modern medicine is started after the Alexander Fleming, when he discovered penicillin.
Right.
And that is the era of penicillin, and they are winning everywhere. But before that, if we go to the history, that homeopathy doctors, they work in frontiers in First World War with these tiny globules, and they are doing operation. After operation, they are giving arnica, calendula, ammonium bromide for the gunshot injury,
Okay.
and they were successful. Not only successful, they get lots of medal from the military superiors, that how successful it was. And in fever, I think paracetamol we are giving to minimize the temperature, that does not necessarily mean that your child is cured.
Yeah.
That is one thing. So cure and temporary annihilation of the symptoms is totally different.
Yes.
Permanent cure is something else. Because even if we think diarrhea, in homeopathy, it takes footing in India or especially Bengal by treating diarrhea and cholera. That time there was no oral salts, no?
Yes,
ORS. So, and they took the laurel. And most of the freedom fighters, they used to take homeopathy medicine. If you go through the history, because why and how homeopathy develops in India, because modern medicine was known as Ingreji Dawai. Okay, so Ingreji Dawai, and to make a revolt against this Ingreji Dawai, during that time most of the freedom fighters, they used to take homeopathy, and how they supply and distribute homeopathy, whenever there was any cholera or any epidemic, they distributed homeopathy medicine to control this cholera during that time in 18th century.
Okay.
And by this way, homeopathy was practically, it was popularized among the in India.
Okay.
And not only that, another story I am telling you are telling that it is
So it
very
is not
slow
a slow
acting.
acting drug. It is not.
It is absolutely not. Definitely we know the name of Maharaj Ranjit Singh of Punjab.
Punjab.
All on a sudden he was suffered from paralysis. Because after exposure during fighting or in war, he was fall down, and that time heavy rain, due to he has developed paralysis of one part. And Heisenberger, that time he was traveling from the German doctor, and he treated with Dalkamara, and within few days his paralysis was cured.
Oh, that's amazing.
Because for paralysis, it takes years together, months together. So it is slow acting in the sense, in some condition, it is really, it takes time. Because especially not on the children. Children are suffering from the joint pain also, that is rheumatism, juvenile rheumatism, especially this type of children, those who are mentally and physically weak, they may be the victim of this. Joint pain. It is, I am not telling the growing pain, but joint pains are there. And there also, you will get in good number of children started the joint pain after the suppression of the diarrhea. Mother is telling, last 2 days, he had diarrhea and vomiting. I take some medicine, he gives some medicine, he was all right, but within 1 day or 2 days, her joints are involved, and patient is now crying. This is known as reactive arthropathy. So whenever any amoebiasis, diarrhea, checked diarrhea may lead to joint pain. Okay, it is extremely dangerous. Even if the joint pain, you are giving some ointment, it may lead to your heart, cardiac attack. It is scientifically, it is true, in every medicine is telling, but only homeopathy can treat this type of reactive medicine. Reactive arthritis for among the children. So, treatment, you are taking any anti-inflammatory tablet, steroid or other medicines years together, because it is autoimmune disease. It may take 6 months, 6 years, 7 years, you are taking, and ultimately you becoming handicapped. But if you give, whether you really give 6 months time to a homeopath for this joint, but we are telling that homeopathy is slow acting. It is totally not, absolutely not, because cure is something else. Because we are not treating this joint pain. Rather, we are treating that other way, how it reacts.
Right. So the response is totally dependent on the person, the reaction, and the constitution. Okay, just like any other therapy. Also, now I would like to know what your experience has been at Bal Kalyan, and also, homeopathy, again, people don't know much about the costing and the accessibility. So how you think your camp and your sessions have helped the people around Pune in terms of affordability and accessibility of the medicine?
What I am telling that is, what I am telling that I am attached with this Bal Kalyan Samiti, rather I think I am really honored in the sense that you are doing so much versatile activities for these special children, that it is amazing. And definitely, if we continue this type of workshop or the treatment for a pretty long time, and if they really give a scope to us to continue this type of program, then it will be really example that how tiny globules can change the entire scenario. And definitely Bal Kalyan Sanstha is showing the path that if we integrate all systems, including homeopathy, we can minimize the mother's suffering, parents' suffering, and we can show some light where there is no light. Total darkness, and children are smiling, parents are smiling, and what more we can expect that definitely Bal Kalyan is really doing such a great job with all personalities, those who are attached to it, this Bal Kalyan Samiti, and I am really thankful to them also, and I think further activities if they can enhance along with homeopathy and other co-activities, definitely we can give some smile to these special children.
Yeah, I'm sure you have given hope and smile to so many people. Now with Bal Kalyan, we are able to make a difference in children's life, and that is also commendable. Now so that more and more people get advantage of this, how do you think we should go about awareness and accessibility and affordability of the medicine? Bal Kalyan is doing its job. Now if we have to expand it to maybe other parts of the state or other states of India, what should we do, or what should be the guidelines, your advice to government or any other governing body?
Actually, I think that you people are already doing, that is the documentation. We can make a story, we can show in the PowerPoint, whatever it is, but until and unless we can show the result, madam. That is my question. Homeopathy is good, allopathy is good, occupational therapy is good, speech therapy is good. Okay, everything is good, but the problem is in homeopathy, because as you are telling, it is not yet socially fully recognized pathy.
Yes.
So I think here not only you people are helping us, but we have to help ourselves also. I mean, in which way? We have to criticize our performance. I am telling in another way. Until and unless homeopathy teachers or doctors are able to show the result, whatever advertisement from Bal Kalyan Samiti, through television, through newspaper, you can give, but everything depends on the performance of the doctor. If we analyze the case, yesterday or day before yesterday, so many new patients are coming from the, I think, military section, I think from the airport.
Yes.
So how they come to know? Because one or two patients, they get result and it is spreaded like anything. Maybe at the present moment, that medias are very strong, but still my own belief is that mouth to mouth or ear to ear, that is the best media for advertisement.
Right. Yeah, mouth publicity is the best.
Best. So you are telling, oh, go to Bal Kalyan, because I think there is some hope. So homeopathy doctors have to be rather standardized or improve. They should criticize their own activity, criticize in the sense that how we can perform in a better way to give better relief to these children. Okay. And automatically, I think governing body or the government, for that reason, you people are there, because yes, treatment is something else and management is something else. You have to correlate. But if a doctor become in administration, definitely he will lose his capability of prescription. I believe it.
I completely agree with you.
Because then you have to write down in letter number such and such, dot. No. You have to forecast totally, just like a pious fellow, a yogi, that how I can enter into the core problem of the child. What medicine is needed, what accessory thought process, accessory help we can do with our advice. Still, because why I am telling that understanding is something else. A child was diagnosed here last time when I came, that ADD beats everybody this and that. When I am taking the case, then ultimately father is telling, no. He beats me, only me, not not mother. Then I was shocked that why son is telling. Then again we retake the case very nicely. Father actually, he is very nice story. He actually working outside every 15th day or every 1 month he is coming home, and mother and the son is staying there. And that the complexity, whatever it is, you can say Oedipus complex or whatever it is, when father is coming and staying with wife or the mother, what I'm telling, the son compelled to sin in between there. Even if you keep the child in another cot or side, when child is awaking, he come in between, sleep in between parents. And after awaking, he is beating father, because my mother is my property. And you are taking share of that. Okay, that the jealousy or whatever it is you are telling,
possessiveness, or even the comfort, for example,
whatever it is. So, and we give the medicine that we have this group of medicine, jealousy, sibling jealousy, this type of relationship jealousy, and other symptoms also. Child was very hot, and we give the medicine and child get cured. That ADD, ASD has totally cured. So you have to, as a psychologist, you should know, you know better than me, that this type of cooperation from every aspect, I think we can make a better world. You have to understand everything. You have to understand homeopathy, you have to understand psychology, you have to understand dietetic error, you have to understand the sociology, economy, everything. It's a huge chapter, but even if we are concentrate our activity, if we perform our activity perfectly. Then jointly we can do so many things. But we have to be a perfectionist in our work. Then only homeopathy will survive, then only homeopathy will spread. Rather, you will spread homeopathy through the result. Until and unless there is no result, nobody will accept homeopathy.
True. For that, we need a really strong support system in every aspect. Now, having one special child really puts pressure on the entire family. The father who has to go out and work, the mother who has to take the entire responsibility of the child, and also other siblings who might feel sidelined. And then there are relatives and friends. So, a lot of times I come across patients, the parents are really stressed. What is your message to the parents to support their children through homeopathy and to continue the therapy of any sort?
Actually, first thing, honestly, I am not advised, but actually I can inform something to them, that they already have a lot of patience, but definitely they are also tired one.
Right.
It is not possible. So, and before that I am telling another thing. Here what we are observing, lots of, not I am telling chromosomal defect also, lots of children, they are the victim of the marriage in the same relationship. Anyhow, we have to stop it. I am not telling any religion or this and that. It is really, really making problem. Number one. Number two, the plant children minimize the use of this, what should I say, that hormonal barrier, that is the contraceptive pills. Least use is best for the next children, because nowadays everything is modified, na? So even these hormonal pills, it is apparently it is not doing anything harm, but definitely hormone relationship is such complicated that imbalance of any hormone, thyroid, pituitary, estrogen, progesterone, whatever it is, today or tomorrow it will produce something wrong. Whether we deny or not, we believe it or not, no question of believing. So before this type of, when children are becoming already this type of disabled children, think 50 times before taking or bringing any children. And don't take any contraceptive pills at least for 1 year, 2 year or 3 year. After that you take the children.
Okay.
That is one thing. Because everybody is adult or everybody is now mentally adult after observing so many things in video, TV or whatever it is. We have to be very much cautious regarding this use of contraceptive pills and others.
Okay.
Okay.
I think that's a very important.
Very big, yeah. We are observing every day.
Yeah. Yeah, I think this is what these are small things that people are not aware of, and we need.
But we can utilize. You can exercise this very nicely,
yes, na? Yes. Yeah. So this is the awareness that I was talking about. Small guidelines on a day-to-day basis, what people can practice.
And least medicine, madam.
Less medicine. Yeah.
Because most of the time we are saying deficiency, but I think deficiency at the present day, until and unless very poor, it is not the deficiency, rather the mal-assimilation. We are telling that vitamin D deficiency, vitamin B deficiency, but from our family, how it is possible? Because our lifestyle have to be changed.
Exactly.
Otherwise, everybody ultimately will be the victim of osteoporosis. Yes. Lifestyle is more. We are not deficient, rather vitamin C or B, it is not assimilating.
Yeah, we are making incorrect choices as
incorrect
far as
choices. Because this nowadays every mal syndrome, rather we can say it is a mall syndrome. We are attending malls, and it is producing lots of mal in our body. So think in that way that it is a complex problem, but that burden can be minimized if we change our thought process and our activities.
True.
We have to think in the otherwise. Otherwise, lots of children, ultimately this autism, as in nutshell, that autism, it was not prevailing that time, madam. At least even 50 years, 10 years ago, 20 years ago, 30 years ago, we have never heard the name of this medicine. Yeah. Okay. But as world is burdened, it is burdened. It's a broadening spectrum, and disease also it becomes the broad spectrum.
Yeah. So, and this brings to my last question, that now 2 years of seeing so many patients, so many success stories, and everybody has seen the results in the children. What is your next plan for Bal Kalyan Sanstha and the children here?
Madam, it is not one-man journey.
It is not. It's definitely
as
not.
You people are the soldiers, I am telling but we have to create good doctors. Okay, again I am telling, we have to good doctors.
Yeah.
And as a psychiatrist also, what I am telling, that try to convey another message to the parents, that give proper time to the children. And another, the problem with us now, everybody is thinking one child, one baby syndrome. And most of the one babies are irritable, cross, peevish, aggressive.
Yes.
Because they are, and their demands more and more and more and more. They are unable to share anything. Yes. Because during our time also, we brothers, sisters, we share so many things. But they are mentally they are not matured or perfect. So parents have to think that how to deal that situation. And another thing, the parents also are becoming very much impatient. When you are scrolling the
reels
no? How many? Within 1 minute, mostly 50, 60, 70 stations we are going.
Yes.
But have to be patient. Listen to your child properly. And after treating so many patients here, what I am observed, that some hyperactive children is really they are hyperactive, or that is the creation from their mother or father. Because mothers and fathers, they have their normal reaction. Child is crying, child is laughing, silently making, joking, laughing, everything tell hyperactive. Hyperactive. What does it mean? Normal life, normal expression, that also parents at the present moment, they have no time to patience hearing or patience tolerance. Child is laughing 1 time or 2 times on the bed, oh my goodness, most probably hyperactive. This thought process have to modify it. Otherwise, most probably we become hyperactive, our children become hyperactive, and society also become hyperactive. But patience is needed from Bal Kalyan Samiti, from doctors, and from institution. Otherwise, the whole society, it will be impatience.
Yes.
It's a long journey.
It's a long journey.
Long journey, and ready-made nothing will get. But if we work together, definitely we can change the scenario. If not change, at least we modify the scenario. Okay.
That is an immeasurable piece of advice. So thank you so much for this enlightening, very informative and very motivating speech. I'm going to take so many things into my sessions and motivate my patients, their parents more. And I believe all of you must also listen to Dr. Sarkar's tips and guidelines that he has given from his experience. And we hope at Bal Kalyan Sanstha that you have enjoyed this segment of VICHARDHAN. Thank you.
Like, share and subscribe to our YouTube channel, and do not forget to press bell icon.